patient has not been on the cutting edge of technology or ready to address some of those pieces, they may not have the knowledge base yet. So we need to make sure that we have those understanding that their bad habits may exist and how to help them get over that.
Mm-hmm. And what about their assets? Do they have any?
Oh my gosh, their assets. They bring the education. They bring their years of experience they bring to the table as a nurse. So again, they come in and they're ready to hit the ground running in terms of they've already know the language of medicine. They already understand a lot of the social norms that we kind of have in medicine. There's a lot of pieces they already know, so they can really just be ready to start and ready to learn and get the next piece of clinical knowledge out there. So, I mean, that's a huge piece. They know how to talk to patients. They know how to work with families. They know a lot that they don't give themselves credit for.
Mm-hmm. And do you think that it has anything to do with the way they're coming to a better clinical judgment?
So better than the direct entry counterparts, or?
Just better in general. I just mean, like, I'm wondering if somebody who has worked as a nurse is more capable of, or is starting with a head start with this whole process of learning to diagnose and make treatment plans.
So starting out at, I think it's in the beginning. I think in the start they may be starting out at a better place in terms of they're ready for, they know what they're going into. They thought long and hard usually about entering back into education to get their advanced degree, so they know what they want out of it. So a lot of times my direct entry students won't have any idea what specialty they want to go into, whereas my previous nurses know what area they want to go into. They're either working in it or they have an interest in it, or they kind of already know what they want to get out of the program before they start it, whereas the direct entry students are just taking a day by day and seeing what they get out of it, whereas sometimes my experienced nursing students already have know what they want out of their degree.
Mm-hmm. And are they better at coming at impressions or diagnosis?
I think it depends on the student, really. I really think that, again, in the first clinical, they might be because they're not playing catch up, but I think that quickly equals out depending on the student and their either their confidence or their clinical judgment skills or their assessment skills. There's so many different factors. I think that equals out pretty quickly.
Mm-hmm. And you said a couple of times that like nurse practitioners are nurses first.
Yep.
And when we think of the nurse practitioner role, it's often said that this is advanced nursing practice, but also a piece that is medical practice. So what is that nursing piece that's in there?
Well, I think that I don't know if I would define an NP as part nurse and part medical. I think that we're all part medicine and that NPs are advanced nursing roles. I think it's just expanding upon the nursing scope of practice. So I think that when we talk about the nursing piece, I think we're focused on the holistic care of the patient. So we're looking at the whole body. I think we're really focused on being present with the patient. So having a clear focus on the patient and the patient as in their entirety, I think is really, really the core of what it means to be a nurse. I think it's just expanding upon that by giving some advanced assessment and advanced skills to the role.
Mm-hmm. But this is all, like these advanced skills, is a whole new set of skills that they have to learn whether they're nurses or they're not, right?
They're new skills that they need to learn whether they're nursing or not, yeah.
Mm-hmm. And do you think the length of nursing experience has to do with how they evolve in the program, or Like somebody who has like many, many years and somebody who just has a few years as a nurse? Do you think there's a difference?
No, I think that that equals out pretty quickly. I think that really does. It depends on the person and their how clear they are going into it with what they want to accomplish and what their goals are. And I think that, you know, how it really does equal out. I don't think it has a lot to do with their years of experience as a nurse.
Mm-hmm. All right. And I'm just looking at my questions now. And the other thing you said is you alluded to nursing principles in your program that are really at the core of the teaching you provide.
Yep.
Can you describe what you mean by that?
I think it's the same thing I was just talking about with in terms of that patient at the center and being present with the patient and those really nursing core principles or values, you know, going back to the really simple things of listen to the patient, listen to the what's going on, and being able to communicate with the patient in that way. So I think it's just being present and being a holistic approach to patient care.
Mm-hmm. All right. So I think we've gone through my questions. Is there anything else you'd like to share with me about all of these points we just discussed?
I don't think so. Nothing I can think of.